March 2003, panic grips Hong Kong as a deadly new virus sweeps through the city, one of the most densely populated in the world. The Amoy Gardens estate is sealed off after hundreds of residents contract severe acute respiratory syndrome, or SARS.
No one would come to Amoy Gardens. Even the taxi drivers refused to take people here.
Simon Say and his wife Rosa were two of the 1,800 people in Hong Kong infected with SARS. The highly contagious virus is thought to have spread from bats in southern mainland China.
I
was so scared at the time. I was consumed by fear because I'd always been very healthy before. When I was in intensive care, I felt even more scared. I couldn't breathe. Never in my whole life had I felt that I couldn't breathe.
Simon and Rosa made a full recovery, but SARS killed nearly 300 people in Hong Kong and infected 8,000 globally. The Prince of Wales Hospital was at the front line of the battle.
And SARS actually first occurred in Ward 8A. So the index patient came in on the 4th of March 2003, and within 2 weeks he infected 138 patients, including some healthcare workers.
David Hoy was one of the key doctors treating SARS patients, many of them his colleagues. He says health protection measures and personal hygiene have drastically improved in Hong Kong over the past decade.
We are now inside a double-door negative pressure isolation room, and you can see we have 2 beds side by side, but the bed-to-bed distance is at least 1 meter.
Here in the labs of Hong Kong University, scientists are closely monitoring a SARS-like coronavirus outbreak in the Middle East. And they're constantly on the lookout for mutating forms of avian flu that could spread from human to human. Yuen was one of the microbiologists who identified the SARS coronavirus behind the 2003 outbreak.
Because of global traveling, especially through air travel, an infection at one place can easily spread to the other within 24 hours. So I'm sure that all these emerging infections will come again. The magnitude is difficult to predict, but it can be very fatal, it can be very widespread. We must prepare. If we don't prepare when the disaster comes, it's a replay of Hong Kong in 2003.
SARS had a huge impact on Hong Kong, and the city is poised to spring into action when, rather than if, another highly infectious disease emerges.